mask and when not to use a mask, and how to behave in public places, etc. There's a lot of confusion, not only among general public but also among healthcare professionals. And I've seen it at my workplace where I'm having to educate people. There's very clear guidelines from Public Health England that there is no role of using a face mask or gloves in your general day-to-day life. The only time you have to use a face mask, or you should use a face mask when you're coming within 2 meters of a distance of somebody who may be having a coronavirus, or who is suspected case of a coronavirus. And that's when you would be using full protection gear, which would mean gloves and apron and face mask. And the breathable face mask, the ventilator face mask, which is only used when you're dealing with secretions of a patient. So for a general public, normal 3-layered face mask is only recommended when you are caring for somebody who has got coronavirus, suspected coronavirus infection, and you are within 2 meters of their distance. One of the ongoing challenges of how to keep your elderly relatives, parents safe who live with you, in particular people who live in joint family arrangements, they have elderly parents above the age of 70 who fall in the high risk group for susceptibility to coronavirus. Also, people who may not be elderly population but they are high risk because of either being pregnant or having multiple physical health conditions, most specifically for the respiratory conditions. How to start isolating, social isolation with them. The principle to understand is the virus has a 7-day incubation period. So from any point from day 1 to day 7, you could start having the infection. Therefore, if you are isolating as a household, you say you got one elderly parent in the family who's 70-year-old or a vulnerable individual, and you've got 3 other individuals living in the family. So the 3 individuals living in the family can intermingle with each other. However, for the first 14 days of the isolation period starting, they have to stay at least 2 meters and more away from the vulnerable individual. Past 14 days, if nobody has had any infection, at that point onwards, they can start to mingle normally within a household. However, if any one of the other 3 who are not in the risk group go outside the house, and so therefore they carry the risk of bringing infection in, they therefore need to maintain that distance with the vulnerable individuals. If all of you are staying at home and none of you is going out, then you can intermingle normally. So this would reduce the risk of isolation and alienation and loneliness in your elderly family member or any vulnerable individual you reside. I hope that clarifies it. And if you want, you could visit the website for Public Health England, which has guidance on these issues.